What is long-term oxygen therapy? Have you ever wondered how oxygen therapy can help those with sleep apnea? Let's break it down and see what long-term oxygen therapy is all about. Long-term oxygen therapy is the continuous or extended use of supplemental oxygen. It aims to increase the amount of oxygen in the blood. This therapy is often delivered through devices like oxygen concentrators or tanks. Typically, it is used for chronic lung conditions that lower blood oxygen levels, such as chronic obstructive pulmonary disease. When we look at sleep apnea, particularly obstructive sleep apnea, long-term oxygen therapy can play a role. In obstructive sleep apnea, oxygen is provided during sleep to improve oxygen levels when they drop due to airway blockages. However, it is important to note that long-term oxygen therapy does not address the root cause of obstructive sleep apnea. The main issue is the collapse or blockage of the upper airway during sleep. Patients with obstructive sleep apnea experience repeated episodes where breathing temporarily stops or becomes very shallow. This leads to intermittent oxygen deprivation. While long-term oxygen therapy can help increase blood oxygen levels during these events, it does not prevent the airway from collapsing. This means that the breathing interruptions continue, even with oxygen supplementation. Research shows that using oxygen therapy in obstructive sleep apnea can have mixed effects. It may improve oxygen saturation, but it can also prolong the duration of apnea events. This can lead to increased carbon dioxide levels and related complications. Supplemental oxygen can suppress the body's natural drive to breathe in response to low oxygen levels, allowing apneas to last longer. Unlike continuous positive airway pressure therapy, which is the standard treatment for obstructive sleep apnea, oxygen therapy does not reduce the frequency of apneas or improve symptoms like daytime sleepiness or high blood pressure. Due to these factors, long-term oxygen therapy is generally not recommended as a primary treatment for obstructive sleep apnea. It may only be considered for patients with significant low blood oxygen levels who cannot tolerate continuous positive airway pressure therapy or other airway opening treatments. In such cases, careful monitoring is necessary to watch for potential risks like prolonged apnea duration and increased carbon dioxide levels. In essence, long-term oxygen therapy provides extra oxygen to improve blood oxygen levels, but it does not fix the airway obstruction causing sleep apnea. While it can help with oxygen saturation, it does not prevent apneas and may carry risks if used alone. The preferred treatment for sleep apnea remains continuous positive airway pressure therapy, with oxygen therapy reserved for specific cases under medical supervision.